I'm here with Ava Dickson with Hera Integrative Wellness, and we are going to learn a little bit more about her company and what she really can offer to some people.
So the introduction.
Right? Okay, so let's first start with your journey and what made you become a birth doula.
So I kind of had always known what a doula was. I guess it's just a word that's kind of been thrown out. And so I've known what it was. I never really knew exactly what they did or why someone would hire one. I honestly thought that it was a private kind of
Right.
support person.
Yeah.
For uber rich people who wanted to give birth in their bathtubs. That's what I thought it was. And I guess there are some doulas who practice that way, but
Right.
yeah, that was just my idea of it, ever since first hearing about it, and that was years ago.
Right.
I recently reconnected with the idea after I had my daughter, and she will be 2 this coming November. Actually, next weekend will mark my 1-year anniversary of being a doula. It was right around this time that I started to feel really inspired to consider it for a career path. During my pregnancy with Colette, I had preeclampsia, which is a devastatingly horrid pregnancy-induced disease.
Yeah.
It affects 1 in 12 pregnancies, which seems like a big number. It is considered rare technically, but it's fairly common. So having a high-risk pregnancy and then having a delivery at 35 weeks, I was only 8 months pregnant when I gave birth, so
wow.
I didn't even make it to 9 months.
Yeah.
I had my daughter on 35 weeks on the day. Had a postpartum hemorrhage. I had to have a blood transfusion. It was really scary, and I just remember not being able to fully process what had happened to me, and not being able to process how everything went from 0, perfectly normal, healthy first pregnancy to 100, being admitted to the hospital, and
Right.
having to have a blood transfusion and having 6 doctors in my room while I'm trying to push out my baby.
Super scary.
Exactly. And I was only 20 when I had her. So, which, obviously 20, it's you're an adult, but you're not really ready for that
Right.
intense of a situation. There's really nothing that can prepare you for that as
Right, exactly.
a 20-year-old girl. The doula was something that I wish that I had had in retrospect. I got out of the hospital and I started to kind of go into a deep dive about preeclampsia and about my situation. I started trying to look for kind of community in other women who had what I had dealt with,
Right.
and even just trying to teach myself more about what I had gone through, is when I kind of circled back to the whole doula idea. How can I just felt this burning desire to be involved somehow and to make sure that other people knew about this and that they knew that it didn't have to be my story.
Right.
It can go better.
Right. No, I love that. So maybe just go a little bit into more about what a birth doula is, because I know not many people know exactly.
Yeah. No. Essentially, a birth doula is a private support person. It is a pregnancy professional that a family will hire to guide them, coach them, educate them, support them physically and emotionally, and prepare them for childbirth,
Right.
as well as throughout pregnancy, depending on when the birth doula is hired. In my practice, we focus on 3 main pillars. We focus on education, preparation, and advocacy. Birth doulas have been around since the dawn of time. The first profession for women in society was midwifery, and along with that came, kind of a lesser role. A lot of times back in the olden days, they'd be called birth assistants, who would assist the midwife and assist the mother and the family throughout the childbirth process. Now it's a little bit more modern. Doulas can work with doctors and midwives. It's mostly a term that refers to a person who is hired by the family for private one-to-one pregnancy and childbirth support in all sorts of ways.
So what would be the reason why somebody would want a birth doula?
The most common reasons that I see my clients hiring me is because they're going through a complicated pregnancy. And so I specialize in high-risk pregnancy, and I exclusively work with clients who are high risk or have special circumstances, including but not limited to like preeclampsia, gestational diabetes, a planned C-section. Maybe they know that they're getting induced. Maybe they are advanced maternal age, which is mothers over 35. Maybe they are a surrogate, or maybe they know that they are planning on giving this child up for adoption. I primarily serve families with extraordinary circumstances.
Okay.
So the number one reason is because they fit one of those criteria, and maybe they just feel a little bit alone. Maybe they have a supportive partner, but their partner isn't necessarily educated in the way that someone who is, certified in childbirth and pregnancy education would be. If they are someone who's giving birth alone, or maybe doesn't have a strong support system, if there's someone who struggles with advocacy, or maybe just knows the statistics around giving birth in a hospital and the rates of medical malpractice and the rates of unwanted C-sections and unwanted interventions, we want to be able to prevent those things.
Exactly.
Oftentimes, too, if people have really high expectations about what they want their birth to look like, it's extremely difficult and nearly impossible to execute without a pregnancy professional.
Okay.
Yeah.
Okay, awesome. So you mentioned a lot of medical malpractice that goes on in hospitals. Maybe go into that a little bit more, just because I feel like it was pretty eye-opening to me to learn some of that stuff,
I know. So obstetrics is essentially like maternal and fetal health. Gynecology is just women's health in general. So in obstetrics and gynecology, we see a lot of lack of informed consent. Oftentimes this just comes down to really like the root cause is kind of just how women have played a role in medicine since the beginning of medicine. Oftentimes women's health was just overlooked in general, and unfortunately we've developed along that path. So women's health and pregnancy healthcare have always taken a back seat. So because of this, oftentimes there's a lot of doctors practicing in the field, and we have clients and even, women and families who maybe don't have a doula hired, but they still experience instances where they're not fully able to give informed consent. Maybe things are dumbed down for them because their doctors simply don't think it's important or don't think that they would understand what's going on anyways if they tried to explain. That's actually a really common one that we see in the hospitals. Oftentimes we see just a lot of like blatant medical misogyny in the way that medicine was built for men by men in the early, when everything all kind of started to become modern medicine. And so lack of representation in women's healthcare as well is a really big issue, especially for like women in marginalized communities, so like former addicts or
sorry, my eyes
no, it's
are
okay.
like water.
It's okay. Cool it off.
Okay, we're good.
But like, so examples of that would maybe be like former addicts, whether it's the mother or the partner or other people in the family, low income families, families of color, or maybe families who aren't originally from America, but now they're participating in the obstetrics and gynecology and how it's practiced here. A lot of it can be, a big culture shock to see how some of these types of patients are treated in the hospital. Sometimes it's intentional by the providers, sometimes it's not. Unfortunately, it just comes down to how they were trained, and it's kind of just engraved in their brain that it's acceptable to treat, pregnant patients and their families as if they are a number, as if it's one size fits all, et cetera, et cetera. Oftentimes, the medical malpractice is a lot less direct than you would expect. It's not like just blatantly assaulting these women. It's more of like not fully giving informed consent. One that we see really commonly is during conversations about electrode fetal monitoring, which essentially is a practice of getting baby's heart rate on a monitor before birth. So electrode fetal monitoring, essentially it's where they put a little magnetic screw into the top of baby's scalp while baby is still inside of the vaginal cavity. When baby starts to fall off of the monitor because it's they're being pushed, through and out the body. And a lot of doctors and even midwives and nurses will tell their patients that, oh, it's just a little sticker that goes on top of baby's head, when in reality, it's an invasive procedure. And it doesn't mean that this procedure is inherently wrong by any means, or that it's barbaric or shouldn't be practiced or whatever.
Right.
It's just that these families don't actually know what's going on to their child and to their own body. That's just one example, but a lot of it revolves around informed consent. And doula presence in the delivery room reduces rates of medical malpractice. This has been proven.
Right. I know that you said there was a statistic for C-sections.
Yes.
Yeah.
So this kind of particularly relates to inductions. An induction of labor is essentially using hormones and medications, and sometimes mechanical forms like a Foley catheter to open the cervix and induce uterine contractions to make baby come early or whenever. It doesn't necessarily just have to be early, but a lot of times they are used for emergency reasons when baby needs to come sooner than they're ready.
Right.
It's an alternative to a C-section. It's less invasive, and it gives baby the benefits of having a vaginal delivery, and it gives mom the benefits of having a vaginal delivery. However, because inductions can fail and because they can be very slow to progress, a lot of providers will use that as an opportunity to get one patient in the door and get another patient out the door as quickly as they can. I don't want to say providers. We'll say like hospitals. Like, it's mostly administration and insurance companies that are pushing for that. The providers are, I don't want to make them out to be the bad guys, because they're not the bad guys, but I feel like it's easier to understand if I use language like that. So by provider, I just mean the healthcare system in general. About 40% of all inductions actually end in C-sections, and not all of them are really necessary at all. Oftentimes they're just done for things like lack of progression, which will happen if the body's not ready to have a baby. In cases of emergencies, of course, a C-section would be preferred over waiting and having mom and baby's life be at risk, which is mostly the kind of clientele that I work with when I'm seeing C-sections. However, in situations like elective inductions, where the parents have agreed to an induction of labor simply because it's convenient or they want to, or maybe they have a trip coming up and they really need this baby out. And not everyone thinks like that, but there are lots of patients who do prefer to have elective inductions just for the sake of, convenience and clarity. And in those instances, they're actually putting themselves at higher risk for a C-section simply by not letting their body go into labor by itself, which is really fascinating. Yeah. So about 40% of all inductions will end in a C-section. Whether or not they're necessary is kind of debatable. I don't have an exact statistic on that, unfortunately. I do have a statistic about doulas and reducing the risk of C-section. Having a doula present at your delivery, or even just having one hired that you're working with throughout pregnancy, can reduce the rate of C-sections by about 39%. So if you're getting an induction and you don't want a C-section, hiring a doula for an induction of labor reduces that risk of C-section almost entirely.
Yeah, that's amazing.
Crazy.
Maybe you just want to talk about how the process works during pregnancy, while in labor, and then after. I don't know if you explain it any differently than that.
It's fine. The terms that we typically use would be prenatal, antepartum. Antepartum essentially is like when someone needs to be in the hospital to prevent labor, essentially, or if they need to be on bed rest or be monitored, that would be considered antepartum. Not all parents will go through an antepartum phase of pregnancy. There's labor and delivery, and then there's postpartum. It's a lot of words, a lot of medical terms. Essentially, prenatal means pre-baby. Pre-baby, but during pregnancy. Before pregnancy would mean preconception. Anyone who has not yet had a baby or is in a stage of life before pregnancy is in a preconception stage, regardless of their intent for childbirth. So we have preconception as well. I guess I'll add that to the list. So preconception, before pregnancy, prenatal, before baby, but during pregnancy. Labor and delivery, of course, you're in labor, you're actively pushing, baby is coming. I know that there's a medical term for that, but for simplicity's sake, I'm not going to use it. And then we have postpartum. Postpartum is also considered the fourth trimester, which isn't an official term, but it is pretty widely used, at least amongst the doula community. So that is also a term that you might hear thrown around. Essentially, the beginning of pregnancy all the way up until delivery contains 3 different stages. So there's the first trimester, the second trimester, and the third trimester. Okay. Really easy to remember. Right. There's a common misconception that pregnancy is 9 months long. Pregnancy is actually 10 months long, with the first day of the 40th week being the first day of the 10th month. Most first-time moms will actually go over their due date and deliver in their 10th month of pregnancy instead of in their 9th month of pregnancy. Oh, wow. So, yeah, the 9th month starts at 36 weeks and then ends right before 40. So that's a little fun fact. A lot of people don't realize that.
I guess I did not.
Yeah. I know. I mean, you're told what you're told, and that's it. But yeah, so 10 months long. The first trimester, technically, it's from the first day of your last period all the way until, it's kind of debated, it depends on who you talk to, but the 13th or 14th week of pregnancy. Some people will say that the 14th week of pregnancy will start the second trimester. Some say the 13th. So I just kind of, group those together. Right. Something important to note about this is that the first trimester and like dates of conception can be vastly different. So your due date when you get pregnant is actually typically the gold standard is not calculated from conception. It is calculated 2 weeks before conception or the first day of your last period. Okay, right. So 1 week after your period, you're already 1 week pregnant, essentially. Right. And it's not like that in every country. That's just kind of how it is in America. I know in France they do it differently. In the UK they do it slightly differently. So it's not standardized like that, but that's typically how we do things here. Your due date essentially can be roughly 2 weeks off from the actual day that you're told when you go to your first prenatal appointment, if your doctor is calculating based off of last menstrual period, or LMP. You'll see LMP. That's kind of the gist of the first trimester. Oftentimes this is associated with like the morning sickness. There's higher risk of miscarriage in the first trimester. So those are kind of the things that are associated there. A lot of people choose not to announce their pregnancies until after 12 weeks because after 12 weeks, the risk of a miscarriage significantly reduces. A lot of people don't realize, too, that miscarriages that do happen in the first trimester are almost exclusively due to chromosomal abnormalities. So that's kind of an interesting fact there. And I think a lot of people, too, think that miscarriages are their fault or their partner's fault. And again, it's really not the case. If it's within the first trimester, there's a really, really solid chance that, the DNA simply wasn't compatible, and it's science. In the second trimester, this is a lot of women's favorite time to be pregnant. Okay. You get the cute little bump, you don't feel like a whale yet. You get all of the cravings. The morning sickness typically goes away. It doesn't go away for everyone though. And that's also when families will usually find out the gender of their baby. They'll be able to start kind of writing up a birth plan. It's when most pregnancy announcements are made. Second trimester is just full of a lot of fun. It's a very, we'll say hormonally high point in pregnancy for most people. It's not always like that. But it tends to be people's favorite part of pregnancy. And that will last all the way up until 27 weeks and 6 days. Starting at 28 weeks is the beginning of the third trimester. Essentially, the week of viability is when a fetus's chance of surviving outside of the womb skyrocket. Is typically right around 24 weeks. So still in the second trimester, actually. There's babies who can be born in the second trimester and still go on to, survive and live totally normal lives. But the third trimester doesn't actually start until 28 weeks. And then that goes all the way up until delivery. After delivery, we start the fourth trimester, the postpartum period, which is often the most neglected part of pregnancy. And I like to include postpartum into kind of the pregnancy cycle because your body is still running off of all of those hormones and recovering from a physically traumatic event. I mean, giving birth is one of the hardest things that you can do, whether you do it naturally or you do it surgically or whatever. It's really tough on the body. And so postpartum is super important for making sure that you're recovering properly, setting your body up for success, taking care of your mental health, for partners too, making sure that your partners are taken care of and taking care of you too. Technically, in the third trimester, a full term pregnancy is anywhere from 37 weeks to 42 weeks.
Oh.
A late term pregnancy is 42 weeks and onwards, which is extremely rare to go that long. If you're like going past 42 weeks, like the doctors must have messed up the ultrasound really bad, because like your due date clearly was not right. It does happen, I guess, but it's very, very rare to have correct dating and then go over 42 weeks. So
Right. Okay.
Yeah.
That makes sense. So when you do a birth plan with somebody, what does that typically look like?
So I think that it looks kind of different for everyone. I am kind of type A, so I do like to get it all on paper.
Yeah.
I don't like to leave things kind of like floating around in my thoughts. So I have a template that I share with all of my clients. I dedicate an entire appointment. It's typically a 1 to 2 hour long session, virtually or in person, where we go through every possible scenario that could happen during pregnancy and during birth. Even for my clients who are like, no, I absolutely don't want a C-section, we still cover what we should do just in case, because you never really know what's going to happen. And I want to make sure that my clients feel fully prepared for everything.
For sure.
So essentially, we just run through different scenarios. We run through common complications.
Like, what are some of those things?
So that could be like, if I'm working with a client who isn't showing any risk factors yet, but they know that they're going to deliver in a hospital, we talk a little bit about like, well, what happens if you do develop these things? You know, like, here's what we can expect. These are the interventions you can expect. Do you have any questions, comments, or concerns about this? How can we make sure that you are giving the consent for the things that you want and holding consent from the things that you don't want in these situations.
Right.
We do talk a lot about like what interventions during delivery specifically that our clients want to consent to versus not consent to. And all of these things are subject to change. Essentially, we just want to establish like a baseline education, make sure that they're talking about it with their doctor and establishing a really clear plan of what could happen and how they want to react to it. A couple common interventions during delivery would be like forceps, vacuum, and an episiotomy. Those are like the big three. So an episiotomy is essentially a cut in the perineum, which is the space in between the vaginal canal and the rectum. So if baby is stuck for some reason, or mom is extremely exhausted, pushing isn't going too well, but maybe it's too late for a C-section because baby's already in the canal, an episiotomy is typically the next step. It's a cut that's made, and the level of severity is different for every patient, but essentially it's a cut that's made in the perineum to essentially help baby come out quicker and more easily.
Yeah. Is it true that they're starting to do that less commonly?
Yes.
Okay.
So episiotomies used to be pretty standard. Essentially, this was just kind of built off of the idea that women with narrow hips are, you know, not suitable for childbirth, which is a total lie. Your body changes in crazy ways during pregnancy to prepare for labor. Some women do have issues with this, yes, but it used to be considered like a textbook rule. And in that case, they would do routine episiotomies for any woman who looked, you know, too skinny for a delivery. And this is a long time ago. It's not practiced like that anymore. But another example of why, you know, obstetric care needs a little more TLC is so that we can debunk things like that. And cause less trauma to, you know, patients and clients. Another reason that it was done commonly was because it was perceived that a tear caused by an episiotomy would heal better than a tear caused naturally from childbirth. This has also been debunked. Tears in childbirth are completely natural. When they're very severe, they typically do need stitches in order to be repaired, but stitches are way less invasive than, you know, scissors to your butthole. So yeah, that's kind of where that reasoning comes from. But the rates that episiotomies are done at, especially routinely, have significantly lowered. But that's a really great example of that. And it's also a great example of kind of going back to the medical malpractice is these patients will maybe not be told exactly what's happening. They might be told like, oh, we're just going to make some more room for baby, when in reality they're going in and they're cutting these patients open without their consent. It's all about language, and you got to know what certain things mean and translate it to your patients appropriately, or to your clients appropriately. Another great one is the vacuum. The vacuum is just like a little suction cup that goes on baby's head. This one is
I had that actually.
Did you really?
Yeah.
It's way less invasive. There's not as many long-term like negative effects and outcomes compared to other ones. Less trauma for mom, less trauma for baby for sure. But there are parents who, you know, they don't want a suction cup on their baby's head to pull baby out, right?
My head was a cone
Yeah,
for a little
yeah.
while.
So yeah, it's really common that, you know, a doctor might say or a midwife might say like, oh, we're just going to get some extra help pulling baby out, when in reality they're doing an intervention that maybe you're not prepared for, maybe you don't even know about, and then doing it without your consent. And then the last of the big three is forceps. And forceps are exactly what they sound like. Think of like salad tongs, but they're really big and they grab a baby instead of salad. Yeah. Typically, these are inserted into the vaginal canal and put either, depending on baby's positioning, whether or not their head or their arms and shoulders are out yet. It's put around baby, it's squeezed, and it's used to pull the child out of the vaginal canal. Which again is invasive and can cause a lot of trauma to mom and baby, both physically and emotionally. There was just a case, I think maybe 2 years ago in 2023, about a family in Atlanta who didn't realize what their doctor was doing. He ended up using forceps without, total informed consent on a patient who was delivering, and ended up internally decapitating the newborn. And instead of coming clean about it, he wrapped the baby in a blanket, gave it to the parents, and left the room. He later got sued. He lost his medical license. But these things, they're not common, but they do happen. And they happen when you least expect them to. And there's nothing more devastating than realizing that, you know, these options didn't have to be forced upon you. And so that's another thing that we kind of cover in the birth plan is, what exactly do you consent to? Are you fully educated before you're consenting to it? And what other questions do you have for your provider before we make an official decision on this?
Right.
And again, you know, based on the conversations they have with their providers and the conversations they have with me and their partners and their families, these decisions may change over time, which is like totally great and awesome. Right. But at the end of the day, we just want to make sure that everyone is educated. They know all of the risks and the benefits before making a decision and before putting it on paper.
Right. Okay.
So,
yeah, that makes perfect sense.
Yeah.
So when you are making a birth plan with somebody, is that birth plan shared with the doctor before the labor, or is that just for your knowledge for you to kind of help with?
So typically, and every provider is different. Unfortunately, with hospital births and with high-risk hospital births, the way that I distribute birth plans looks a little different from other doulas and other families. Typically, we don't know which doctor the patients will be delivering with. A lot of times, because we are on kind of like an on-call basis, the doctors are also on call as well. So if we have a patient who all of a sudden goes 0 to 100 with their risk factor, for example, at my 34-week appointment, I was just fine. 1 week later on the day, I was giving birth to my baby. So things can change really quickly. You don't always know who is going to be staffed at the hospital. What we do is we try to go over the birth plan and the preferences as a group before delivery. This is great for like inductions and planned C-sections, especially because it does give us time before the procedure begins and before things get crazy to go over exactly what we are looking to get out of the experience with the nursing team, with the doctor. All of the hospitals around here actually that I've worked with, they want a physical copy of the birth plan and they scan it into the patient's chart. So anyone on their care team can look at it at any time. Not only does it make sure that patients are, you know, their preferences are known by everyone on the care team, but it also is great for, you know, legal purposes. These patients now have proof of what they wanted to consent to and what they didn't. And if something goes awry, you know, someone on the care team is not following the birth plan, then we have documentation that it wasn't something that they consented to. So, yeah.
I love that.
Yeah.
That is so good.
Me too.
Yeah, right. Okay. So what are the benefits of hiring a doula in the beginning or / early stages of pregnancy or even before?
Yeah. So hiring a doula, or at least being in contact with a doula and interviewing people to work with your family before you're pregnant or before you're super far along, is extremely beneficial for a number of reasons. Oftentimes the first one is just like simply peace of mind. Getting to know someone who's going to be with you during one of the most intimate and vulnerable moments of your life, giving yourself as much time as possible to get to know them and let them get to know you so that on delivery day, things go smoothly. Not only that, but the amount of education that you receive from working with a doula. I have clients who have done tons and tons and tons of research about pregnancy and what to expect and delivery. And in our first conversation, we're already talking about things that, you know, they didn't even know to think about. So having those conversations early, again, it's the peace of mind, it's getting ample education, it's making sure that you're going through your pregnancy with clear intentions. It's making sure that you're aligning yourself with providers, doctors, nurses, a clinic, a hospital that meets your birth goals. It's also making sure that, you know, you have someone to lean on. You have a professional to lean on during, you know, trying times, and especially in early pregnancy. That's when a lot of that doubt and confusion kind of really starts to arise. And it's just so helpful to be able to call or text someone who, you know, is trained in this. They do this for a living, right?
Yeah.
So those would be the main reasons to hire a doula early. You really get to know who's going to work for your family, less regrets on delivery day, as well as making sure that you are as fully informed and educated as possible as you're going throughout pregnancy week by week.
Right. And even like talking about your health before getting pregnant too. I know we talked about before, like,
So earlier I mentioned kind of how like the preconception stage is kind of part of the pregnancy cycle. And pregnancy health doesn't just fall on women's health, it's men's health as well. And so making sure that couples are educated and informed on how to make sure that they have the best, you know, sperm and egg quality possible to prevent chromosomal abnormalities, to prevent the development of preeclampsia, or to prevent fetal growth restrictions, or at least know how to better manage it, to make sure that, you know, it really is as simple as making sure you're eating the right foods, you're taking the right supplements, you're seeing the right doctors, you're getting blood work done, and you're asking questions before, you know, things turn into an emergency situation. So working with clients before they get pregnant or before they start trying to conceive is helpful for, you know, the clients, number one, to make sure that they have a baseline and they understand how their actions and their current health is affecting the potential, you know, pregnancy that they're hoping for and their child's health in the future, as well as, you know, helping doulas get to know their clients' needs and understanding where they're coming from and being able to see them throughout the entire cycle, that whole first year, from preconception all the way up until postpartum, and making sure that they have the healthiest, happiest, and, you know, least traumatic pregnancy and delivery possible.
Right, yeah. I think everybody could go for that.
Yes.
What would you say sets yourself out from other birth doulas?
So I think that the most obvious one is I do specialize in high-risk pregnancy and hospital birth. Lots of doulas who have experience with high-risk pregnancies and birth in the hospital. However, my training and my education and even like my professional background is specific to these sorts of circumstances. I know we were talking the other day about how I'm going through the process of becoming a surrogate. Having that firsthand experience gives me an upper hand working with families who are also going through the same experience. Having preeclampsia allows me to have a more personal connection with my clients who are high risk for preeclampsia or already have developed it, and wanting to know kind of the ins and outs of what that's going to look like physically, emotionally, and during the recovery stages. The certification program that I went through is accredited by the Minnesota Department of Health, so I'm fully accredited through the Department of Health, which is super important, and not everyone is on the registry. So it's really important to make sure that a potential doula you're looking to work with is registered with, you know, the state entity.
Awesome.
I've also attended trainings through ACOG, which is the American College of Obstetrics and Gynecology. I'm a member through ACOG, and I do lots of trainings on kind of the obstetric model of care, and kind of putting myself more into the education side of the medical world to make sure that, number one, I can translate what's happening to my patients when things are going on the medical side that they don't understand. Also understanding how I can better collaborate with people in the obstetric care system versus the midwifery care system. Learning better how I can collaborate with OBGYNs and labor and delivery nurses, maternal fetal medicine specialists, reproductive endocrinologists, etc., and making sure that I'm not stepping on toes, I'm staying in my lane, but also my clients are getting the most out of their experience with their providers as well. So I've done lots of trainings through them. I'm also on the committee for the Preeclampsia Foundation's Twin Cities Promise Walk. So I'm very involved in the preeclampsia community. I would say that's probably my number one special interest. I work a ton with clients experiencing preeclampsia. 60% of my clients either end up developing it or already have it at the time that they find me. And so I've delivered, 60% of the babies I've helped delivered were from preeclampsia moms, and all of them had positive outcomes.
That's amazing.
Which is fantastic. So my personal connection to, the Preeclampsia Foundation and having it myself, my interest in high-risk pregnancy, my training through ACOG with high-risk pregnancy and obstetric care providers, my fully accredited certification, my registry through the Minnesota Department of Health. I like to think that those things set me apart.
A lot goes into it. Yeah, you can do a lot or...
I know, exactly. So I will say, like, those style of doula-ing that I practice is not for every patient. Clients who are looking for someone to support them through, like, a home birth in a bathtub, like I was saying, I'm not your girl. I'm not for you. And I would be happy to get people interested in that, in touch with people who are interested and passionate about home birth, but really the communities that I serve are, people with those extraordinary circumstances, and that's where my experience and my education lies, and that's what I'm passionate about.
Sure.
So for potential clients and families, parents, friends, family members who are pregnant or looking to become pregnant soon or know someone who is pregnant, the best way to get in contact with me is directly through my email, ava.heraintegrativewellness@gmail.com. I'm not going to spell it out because it will take forever. But Hera, like the goddess, integrative wellness @gmail.com. That's the best way to reach me directly. I check my email daily. Otherwise, you can visit us on our website, www.heraforwomen.com. That's going to give you information about all of the services we provide, not just the doula services. And we serve clients struggling with infertility. We offer health coaching, yoga, and a whole slew of other holistic women's health services. We have a contact page on there. You're more than welcome to fill out. You can also follow me on Instagram @_Ava Dickson. And you can follow my company, Hera Integrative Wellness, @Hera Integrative Wellness on Instagram and Facebook.
Awesome.
Yeah.
So if people were curious about prices, do you have that listed on your website? Would they need to call you?
So we offer full price transparency on the website. We even offer an itemized breakdown of exactly what you're paying for when you decide to choose us for fertility and birth services. We do have tiered packages, and we run off of sliding scale pricing. There's a little bit of something for everybody. For clients who are not local to the Twin Cities area, we offer virtual services. A lot of people are like, well, how would a virtual doula work? I promise it works. And if you have questions about it, please reach out to me. But yes, we offer sliding scale pricing. And then we also offer a quarterly birth doula client scholarship, which allows one family in need per quarter to receive birth doula services completely free of charge. So yeah, in some circumstances, we do offer promotions. Every once in a while, we will have discounts available for everyone. If hiring a birth doula is not something on your radar, but you do want a little extra sense of preparedness for pregnancy and labor and delivery, we do offer free classes and seminars. And then we also have purchasable courses that teach our clients all about labor and delivery. And those are all listed on our websites under the course tab. So, yeah.
All right, awesome. Well, thank you for coming today. It was great to learn about your company.
I know, thank you.
And yeah, we will have to do it again.
Yes, we should.
We can maybe hone in on like a specific topic.
I would love to dive deeper on, anything.
Right.
I could probably talk about pregnancy and birth for hours, so thank you for giving me a platform
of course.
To kind of share what I do and who I serve, and I'm really excited to work with all of you.
All right, well, until next time.